melatonin is the sleep hormone. But what if I were to tell you that that might be melatonin's least important role in the body? Not because sleep isn't important, but because melatonin is arguably the most powerful antioxidant in the human body. Welcome to Functional Medicine for Real World Impact. Today, we're going to be exploring melatonin's role as a systemic antioxidant. Its critical protection of mitochondrial function throughout our bodies, its role as an immune modulator, and just how essential it is for gut healing. Today, I'm going to be sharing with you 5 critical topics about melatonin that take it way beyond an essential hormone for regulating sleep, which is important, and help you to appreciate and feel comfortable working with melatonin as a systemic antioxidant. So let's dive in. Welcome to Functional Medicine for Real World Impact, where we're diving into the complex, interconnected nature of health and disease, exploring not just theory, but practically what it takes to turn functional medicine insight into powerful, practical, real-world results. So please hit subscribe and let's get started. First of all, melatonin is indeed the mitochondrial antioxidant that many practitioners miss. Melatonin is not just a sleep hormone, but it's active as an antioxidant, perhaps where today we need it most, internal to the mitochondria. All of the cells throughout our body have the ability to synthesize local melatonin for local use. And this is not melatonin that we can measure in systemic circulation or even measure the urinary metabolites of. When we measure sulfatoxy melatonin metabolites in urine, we're actually seeing the byproducts of pineal gland melatonin, where we produce it largely just to regulate sleep. But meanwhile, all of the mitochondria throughout the cells in our body are making melatonin for their own local use. And this is a particularly powerful role because melatonin not only is a powerful free radical scavenger in and of itself, and it's actually many times more powerful than vitamin C, vitamin E, or yes, even glutathione. But melatonin, we are learning, actually likely functions as an intracellular master antioxidant. This is because it has the ability to regulate and induce the activity of other antioxidants, from glutathione peroxidase to catalase to superoxide dismutase and more. And the overall redox capacity of melatonin, for example, is 10 times more than vitamin E. And it is particularly essential for the cells in our body, the tissues that are remarkably dense with mitochondria. And this is in particular going to be muscle tissue, in particular the heart, extremely dense with mitochondria. In our neurons, very dense with mitochondria, and also in the gonads, right? In the ovaries and in the testes. I want to talk about the distinction between pineal melatonin and mitochondrial melatonin, because pineal melatonin is essential for sleep. And I'm sure many of you are quite familiar with this particular role. We do produce melatonin in the pineal gland that plays a specific role of regulating sleep timing. Many practitioners have the false belief that melatonin is a bit more of a sedative, that it controls sleep in aggregate. But research has shown that melatonin is most useful for sleep with regard to helping to regulate sleep onset timing, particularly helpful for people who may have trouble going to sleep. Perhaps it is an ongoing chronic issue, or it might be more an episodic issue because of shift work, where individuals are trying to fall asleep at an irregular time that's not aligned to their circadian rhythm. or where an individual, for example, has jet lag and they're trying to transform their sleep cycle timing to meet a local time zone. Melatonin has been shown to be quite effective for these needs, but we need to remember that melatonin is only one hormone, one biochemical involved in sleep. And there are many other hormones, neurotransmitters, and biochemicals that play a dramatic role in not only sleep onset, and we'll talk about that in a minute with regard to the things that interfere with melatonin synthesis, but also the fact that our brain must relax enough to allow melatonin to be effective. We need to promote more GABA, inhibitory neurotransmission. We need to make sure that our cortisol levels aren't too high. And we need adequate magnesium in the body, for example. But melatonin supplementation can be quite helpful for supporting sleep timing and sleep onset if indeed there is inadequate pineal melatonin synthesis. But this is just the one local place where the body makes melatonin that is stimulated by light exposure. And it's actually in response to the falling levels of stress hormones, right? Lower levels of cortisol, lower levels of epinephrine, norepinephrine, and then the retina's perception of darkness that stimulates the synthesis of melatonin. You can think about it as cortisol winds down at the end of the day to give melatonin permission to ramp up. And this starts to help us understand how stress can be a major mediator for impairment of melatonin synthesis, specifically as it relates to sleep. Light exposure, full spectrum light in particular, or late into the evening light can dramatically interfere with pineal synthesis of melatonin. This is where a lot of our modern technological practices and gadgets and working at late at night, scrolling on social media, in particular exposure to full spectrum light or bright light, especially if it's accompanied with jarring or stressful activities that are going to increase that cortisol and maybe increase that glutamate, that really stimulatory neurotransmitter in our brain. These can all interfere with melatonin synthesis. So the pineal gland is important. Sleep is critical for preventing disease and for resilient healing. But again, mitochondrial melatonin is produced on a much, much larger level and provides often overlooked critical antioxidant functions in the body. This local synthesis, again, is intracellular. It is independent of the pineal gland. It is not stimulated by light exposure or darkness at all. In fact, it's stimulated by need. Research shows that, for example, radiation and other pro-oxidant stimulating activities, even applied in local areas of the body, can stimulate greater local melatonin synthesis. But like anything else in the body, no lettuce, no salad. You have to have the ingredients, the biochemical building blocks that are needed to make any critical substance that the body needs to thrive. And melatonin is certainly no exception to that. And I'll come back to that in just a moment. But it's important to understand that melatonin synthesis, more in aggregate, peaks in childhood, in adolescence, and begins to decline throughout adulthood, and can actually be really quite low in seniors and certainly in the elderly. And this can indeed play a major role in the progressive mitochondrial dysfunction that we see. This is going to be, again, especially true for those tissues that are dense with mitochondria, such as our muscles, which become quite vulnerable to insulin resistance, and our heart in particular, and also cognitive decline and the rich variety of neurological diseases that unfortunately are really growing in incidence in our practices. Everything from dementia to Parkinson's disease to Alzheimer's disease and more. Melatonin is particularly critical in the gut. And this is the second topic I really want to dive into, specifically about the role of gut synthesized melatonin. Now, many of you, I'm sure, are familiar with the fact that the gut is the dominant site of serotonin synthesis. And indeed, serotonin is a precursor to melatonin. Our enterochromaffin cells in the gut produce a tremendous amount of serotonin, and the gut produces hundreds of times more melatonin than the pineal gland. This local production influences the health and vitality of all the cells in the gut. They can, in particular, highly influence GI motility, number one, which is especially key for keeping optimal microbiome diversity. It's key for avoiding, for example, irritable bowel syndrome and opportunistic overgrowth of even commensal microbes. Number two, it's critical for barrier integrity, maintenance of that critical gut barrier, and indeed, or inadequate levels of gut melatonin might be at play in perpetuating enhanced intestinal permeability that can be a gateway to systemic inflammation as a result of overexposure to gut antigens and to gut-borne inflammatory mediators. And number three, gut melatonin is also essential for microbial balance. So these are all key for keeping good, healthy function in the gut, a health-promoting terrain in the gut. Many of you know that a key functional medicine principle is that disease often begins in the gut and spreads systemically for overall chronic disease manifestation or even acute localized disease. And so melatonin synthesis and function is going to be essential for keeping us healthy, in particular as we age. But there's another critical role of melatonin systemically that we don't always associate with the gut. And that is its powerful role with regard to immune regulation, which for sure, many of us were never taught melatonin. How could that influence our overall immunoregulatory balance? But melatonin actually is critical for preventing or resolving immune hypervigilance, in particular in the gut, because this is where the lion's share of our immune system resides. Melatonin is critical for keeping a sufficient supply of T regulatory cells, which, as you know, are critical for preventing overreactive hypervigilance or a pro-inflammatory bias in our immune system. And that is indeed at the root of an awful lot of the chronic disease epidemics we see in our practice today. Number two, melatonin can help to lower levels of interleukin 6. This is often a pro-inflammatory mediator in the gut. We know that buildup of it can promote enhanced intestinal permeability, that loss of barrier function. And then increasing systemic levels of interleukin 6 are known to increase permeability of the blood-brain barrier, and overexposure to interleukin 6 in the brain can encourage the hyperstimulation of glutamate, promoting anxiety and worry and hypervigilance neurologically, and the mood challenges that we know often accompany that. And so melatonin needs to enter our clinical toolbox as far as a tool for addressing dysbiosis, a tool for resolving chronic simmering infectious dynamics like COVID or other viral disease, or maybe perpetual opportunistic overgrowths in the gut. And in particular, thinking about its role in preventing and resolving autoimmune diseases, especially because of its powerful impact on T regulatory cells. So I hope you're getting the clarity about the powerful role of melatonin, not just for sleep, but for overall mitochondrial health, in particular for gut function. And because it resides primarily in the gut, for immune function, not just in the gut, but also systemically. So number 3, how do we know if there is an issue with melatonin insufficiency? This is a great question. I said earlier that urinary metabolites of melatonin are largely only a reflection of pineal gland melatonin. Now, this can be valuable because certainly, for example, if the pineal gland doesn't have enough raw materials, cofactor biochemicals that are needed to synthesize melatonin, then it's logical to assume that our mitochondria might also be struggling. But just keep in mind that there are plenty of other things, as I said earlier, that can interfere specifically with pineal synthesis. Full spectrum light, too intense, too late in the evening, higher levels of cortisol, higher levels of glutamate, the glutamate GABA imbalance that we speak of with a real hypervigilant type of mind, really stressful evening activities. All of these things can have an impact and impair pineal synthesis of melatonin that have nothing to do with nutrient cofactors. But for your patients who are struggling with trouble falling asleep or overall inadequate levels of sleep, increasingly our clients and patients are using various wearable devices in order to assess the duration, the depth, the quality of their sleep. And obviously this can be quite valuable as well. So certainly poor sleep may be a sign, a symptom of inadequate melatonin. But I want to give you some other cues and clues to consider, because unfortunately we can't just measure serum melatonin and learn whether our intracellular levels are sufficient or not. So we have to become confident using more qualitative and different quantitative markers to assess melatonin. First of all, we can look at systemic markers of oxidative stress and damage, and whether those are more advanced markers like 8-hydroxy-2-deoxyguanosine, which is an organic acid that is often included in organic acid panels, or whether it is more everyday annual physical type of labs, such as highly elevated HDL, high density lipoprotein, where our HDL has lost its reverse cholesterol transport capability. Or perhaps it is markedly low levels of bilirubin, or maybe markedly low levels of uric acid. We're used to associating elevated levels of both of those biochemicals as being part of a disease manifestation. But both uric acid and bilirubin in the body have notable antioxidant capabilities, and they can become depleted in an environment of excessive oxidative stress. And so that can be a wake-up call potentially that our intracellular environment might be struggling. Another cue to look for with regard to possible melatonin insufficiency is frequent illness, frequent infections, especially viral illness. Individuals who may get sick in this way a couple of times every year, or maybe individuals who have been wrestling with more of a chronic simmering viral illness, whether that is long COVID or perpetual reactivation of Epstein-Barr virus, for example. This can be key because not only are perpetual infectious dynamics increasing oxidative stress and damage in our body, it's also true that tryptophan, which is a key cofactor nutrient for us to synthesize melatonin. I'm going to talk more about that in just a second. Tryptophan can be commandeered by the immune system to help our macrophages to be as effective as possible. And indeed, if we are wrestling with a long-standing infectious illness, it may very well be that so much of our tryptophan has been shunted down pathways to support our immune system that we have inadequate levels of tryptophan remaining for production of serotonin. And you have to make serotonin in order to make melatonin, whether that's in the gut, in the pineal gland, or yes, intracellularly to support our mitochondria. And so we want to question the possibility of inadequate tryptophan availability to make serotonin because too much of it is being sent down what's called the kynurenine pathway. Now, that is the dominant pathway in human physiology anyway, but it can be so prioritized for supporting immune function that very little tryptophan remains to support serotonin synthesis. And we learned a lot in particular during the pandemic about, for example, the effect of a long viral illness in really depleting levels of tryptophan. You also perhaps want to think about individuals with hypertension. When we sleep, part of what helps to keep our arteries healthy and helps us to maintain optimal endothelial function is by becoming big dippers. That is, we have a marked drop in blood pressure overnight. And this allows our blood vessels, especially our arteries, to heal. So much happens while we sleep that is about healing on a micro level and a macro level in the body. And melatonin is a key mediator of this particular function. And so when we, for example, use a 24-hour blood pressure cuff monitor, which is increasingly being used so that we don't risk missing hypertension in a patient or overdiagnosing it, maybe because they have only episodic challenges or they have white coat syndrome. Individuals are increasingly taking home a cuff device that they can wear for 24 hours in order to understand how their blood pressure changes across a typical circadian cycle. And individuals who may have perfectly optimal blood pressure during the day, but yet they keep that same blood pressure at night or it even rises overnight, they're at increased risk for cardiovascular disease. But if we're only checking blood pressure during the day, we might miss this. So this is where a 24-hour cuff can be quite insightful. And when individuals' blood pressure doesn't drop at least 10%, overnight, it might be a sign that there is inadequate melatonin in order to support the body. So we want to think about maybe elevated overnight blood pressure. We also can assess poor exercise recovery, cognitive decline, early menopause, these types of dysfunctions in tissue that are particularly dense with mitochondria, and consider whether suboptimal levels of melatonin might be at play. Now, both forms of melatonin, that is what's happening in the mitochondria and what's happening in the pineal gland, are unfortunately not only declining with age, but also due to stress. And this is not just mental, emotional stress, as I was mentioning earlier, but also higher levels of physiological stress. And like any other antioxidant in the body, our pro-oxidant demands can outstrip our antioxidant capacity. And again, looking at systemic markers of oxidative stress can indeed be quite helpful. But we want to become astute at assessing all of the different puzzle pieces that might point to challenges with optimal melatonin levels. And this gets to another critical point of assessing the availability of cofactor nutrients. As I mentioned, we need tryptophan to make serotonin to make melatonin. regardless of where this is happening in the body. And tryptophan is an essential amino acid that we must acquire from our diet. Individuals who have inadequate protein in their diet or perhaps impaired digestion of protein, maybe because of hypochlorhydria, because of a H. pylori infection in the gut, maybe because they're creating hypochlorhydria on purpose by using acid suppressing medications like proton pump inhibitors. But we can struggle to optimally digest and absorb amino acids from our dietary proteins if we don't have enough stomach acid. We also want to think about the critical role of vitamin B6, which is a cofactor for fueling the enzymes that are needed to synthesize serotonin and then melatonin. And vitamin B6 is a critical cofactor for many enzymes in the body. And we might have a nutrient poor diet. Our patients might be having other behavior or lifestyle choice that might impair the availability of vitamin B6. This has been shown, for example, to often be an artifact of ongoing use of oral estrogen containing medications, such as birth control pills. And there are other cofactors that matter. We need sufficient magnesium to synthesize melatonin. We need to have a good methylation cycle, right? We need SAMe in order to synthesize melatonin. So nutrient cofactors matter, not just consuming them, but digesting and absorbing them, and then ensuring they're not being depleted by other dynamics at play in our body. But stress in particular can impair the enzymes that are needed in the mitochondria for making melatonin. And so this is where we talk often at SAFM about how modern food and our modern toxin load and also modern stress, that trio collectively is promoting an awful lot of disease. It can also be in the way of any durable, resilient healing, which for you as a practitioner, managing those three critical underlying artifacts of a person's life can make a big difference on whether you're only able to manage and control the exacerbation of a disease, or whether or not you can partner successfully with the patient to help guide them toward true resilient healing, so they actually get well and stay well. So, absolutely, we can supplement with melatonin, but as I said earlier, it's critical to assess what might the underlying drivers of inadequate melatonin be. Because if we don't identify them, they likely are claiming other dysfunctions in the human body. But for sure, we can supplement with melatonin. But dosing is not one size fits all. A particular consideration for you clinically, and this is a key point here, number 4, is that high doses of melatonin can be at the root of next morning fatigue, next morning sleepiness, or even headache, and also can be a player in elevated blood sugar the next morning. Part of the natural interconnectedness of hormones is that when melatonin surges overnight while we're asleep, it suppresses insulin levels. And this makes sense from a survival viewpoint. It would have been important while we are vulnerable and asleep. We would not want to risk having our blood sugar plummet. This would especially be key in the early history of man, where food supplies and sources and regularity were much more uncertain. But it is normal for insulin to be more suppressed overnight in order to keep blood sugar at an optimal level, especially for fueling all of this healing, detoxification, refueling of supply work that I mentioned earlier. Sleep is a very busy time. While our peripheral nervous system is largely dormant, we are doing a tremendous amount of repair work and readiness for the next day. But we want to be on the lookout for where melatonin supplementation, especially higher doses, might be over suppressing insulin and occasionally potentially creating middle of the night issues where blood sugar drops too low and we may have more of an incident that actually causes the body to send out a surge of adrenaline and wake us up. But more likely is the scenario where first morning glucose is more elevated than it would be otherwise simply because we use supplemental melatonin the night before. This will be a larger risk if we used a higher dose melatonin or if we used a sustained release form of melatonin. So this is all about bioindividuality. There's not a right answer on the perfect amount of melatonin supplementation. We generally at SAFM teach to start at a low dose of melatonin and to creep up on the amount that is effective, especially for supporting sleep. In particular, starting with even a third or a half of a milligram, which may not sound like very much, but it is still a supraphysiologic level of melatonin. And taking a more of a personalized, guided bioindividual approach. Now, you're likely familiar that melatonin is taken in very large doses for a variety of disease dynamics these days, and it's an exciting area of research. I'm going to talk more about that in just a second. But it's important to understand that plain melatonin that is taken, say often in a tablet, does go from the gut into first pass liver clearance. And much of it is going to be metabolized by the liver. And so less of it is going to be available for benefits outside the gut. And this includes benefits in the brain and central nervous system in order to support sleep. And the effective dose is going to depend greatly on its absorption from the gut, its metabolism in the liver, its uptake, for example, in tissue. And so bioindividuality is key. But when we use a liposomal form or an acetylated form of melatonin, for example, many of you are familiar with these technologies for helping to enhance absorption of something from the gut that we consume orally. This can indeed help to deliver more of it into the body. If that's having a negative effect, the negative effect may be worsened, such as the effects on next morning fatigue or sleepiness or headache, or next morning elevated blood sugar. But if you're looking for more of that melatonin to support systemic needs, then a liposomal or an acetylated form from an oral supplement viewpoint will indeed likely be more effective. Sublingual forms have also been showed to be better absorbed for these purposes. And so we want to pay attention to bioindividual dosing needs, bioindividual effects from both a positive but also a possible negative perspective. Now, the last point I want to make is that if you're only used to thinking about melatonin as a sleep hormone, we want to look below the level of the water and see the much, much larger part of the iceberg with melatonin as an essential antioxidant. And no surprise, it's increasingly being studied in some of the critical functional areas I've mentioned so far, especially with regard to protecting against or minimizing the progression of neurological disease, such as Alzheimer's, Parkinson's, or even post-infectious dynamics like brain fog or peripheral neuropathy. And indeed, a limited time supplementation with higher doses of melatonin, again, in those much more bioavailable forms, will likely be of significant benefit from an antioxidant perspective. Melatonin has also been studied with regard to more optimal recovery from neurological events, whether it is a stroke or other type of concussion, other traumatic brain injury. Melatonin is also being studied with regard to immune regulation and where can we use melatonin in a targeted therapeutic fashion in order to reestablish immunoregulatory control. This might be critical in ongoing autoimmune disease, especially polyautoimmunity, where the dysregulated immune system has, if you will, claimed two victims or more, where we need more T regulatory cells and we need to reestablish appropriate tolerance, but also disease dynamics where pro-inflammatory bias is keeping a person from fully healing from an infection. And we see this in a number of viral illnesses. And it's part of the hallmark, actually, of long COVID or post-COVID disease, where a person is still struggling with marked symptoms even after all evidence of the infection itself has subsided. But we also see melatonin being used in targeted gut dysfunction cases, whether it is to help with, say, mucosal repair on the other side of maybe an ulcer or acute gastritis in the stomach, or perhaps enhanced intestinal permeability and mucosal degradation and damage for inflammatory bowel disease. Melatonin is being explored more and more to help with protecting ovarian function, both for fertility and for more optimal perimenopause, menopausal experience because of its effect on ovaries in particular and systemic inflammation. It can have an impact even on our hormone levels, whether we're talking about estrogen or progesterone, or I already mentioned insulin, but even other hormones such as leptin and oxytocin. So suffice it to say, melatonin is leaving our limited lens of being just a sleep hormone and deserves a powerful place in our toolbox, as long as we are savvy about investigating the reasons why melatonin synthesis endogenously might be impaired, so we can address those roots proactively, and then using melatonin supplementation strategically and in a targeted fashion for a particular purpose, a specific duration, given the need of the individual. So thank you so much for joining me for Functional Medicine for Real World Impact. Please, if you've enjoyed today's podcast, please click subscribe and share with your colleagues.